is Mariana Garcia-Corral, and my position here is a research assistant. And I'm from Mexico, Monterrey. The king of mountains. Wherever you look, there will be a mountain. Beautiful landscape. So the various illnesses that my family has gone through together has motivated me to go into science. If I could reimagine the world, it would be without neurodegeneration so that people could age with dignity. My grandpa, he has something called Lewy body disorder or disease, which is a combination of Parkinson's and Alzheimer's. Seeing somebody kind of lose the most important part of himself, like who he is, his memories. Losing us, you know? Whenever they have a good day, even though they remember everything, they're also like, I'm so sorry that you have to go through this. My mom would call me and say like, your grandpa is great today, he remembers so much. But he's also saying, like, you're taking so much good care of me, like I really appreciate it. So very thankful of having family there, you know? Honestly, what I wish the most is that science could just make like aging such a more dignified process where you could just keep yourself as you, like, your whole capacity. That's really what I would really love since I've seen like all of my grandparents really struggle. I remember when I got my first toy microscope, and these are very common in Mexico. They were called Juguetes mi alegría, which is translated to Juguete, toys my happiness. And they just gave you a microscope and a few microscope slides that had a leaf or like hair, and I would just remember trying to focus with my eye, not being able to, and still trying and getting more samples. And my first job was in a place that was trying to diagnose schizophrenia. Because it's a really difficult disease to diagnose, you have to have like one episode and be hospitalized to be diagnosed. And I saw a bit of the connection between schizophrenia and bipolar disorder, and I empathized a lot with the people that had it because I worked with a few of the schizophrenic patients, and they're just like normal people, of course, but then struggling to control their emotions, and people are not accommodating for those people that suffer bipolar disorder. So I think I empathized a lot with those kind of people, and I wanted to try to help to make their lives a little bit better from what they are now. In that internship, I discovered that the Wyss Institute existed, and one of my colleagues was working at the Wyss and speaking wonders of it, and I was like, this is where I gotta be. So I finished my bachelor's, I finished my master's, and then I returned here and I was like, please give me a job. I'm working on using human brain organoids to try to discover new medicines for the treatment of bipolar disorder. The ones that we're intensely screening are already FDA approved so that it can be quickly repurposed and sent to market. We have a pool of like 200 drugs that we have to go through one by one, check how our model is responding to it, and it's really interesting to see. The more common drug is lithium, which only treats depression. And in bipolar disorder, there's depression, loss of sleep, a lot of obsessive thinking or hyperfocus. So hopefully one of our drugs that we find can treat more than just the depressive side, so can give them balance overall. I think the environment lends itself to a lot of openness and a lot of collaboration, so I really, really like that. How many people are working here, it just gives you access to mountains of knowledge. So if we have direct access to a person that is feeling all the symptoms, then we can try to bring that person's experience into the lab and try to make it more realistic so that we know that what we're doing is actually going to make a difference on how they're feeling. I always think about one of these patients that would just share with me how after eating something that has a lot of sugar, she would have a manic attack. And when I prepare my samples and I know that I'm putting some sugar in, I always wonder, like, is this something that might affect? Should we be looking more into this? I believe science gives people hope. For one of the things I do to help anybody's life would be extremely rewarding, like completely worth what I'm doing here.
Join us as we reimagine the world.